In this section, we will look at parenteral routes of administration and some of the dosage forms that can be administered via these routes. Parenteral means any route other than enteral. So this includes many routes such as injectable routes, ocular, nasal, topical, inhalation, and so on. However, when you hear the term parenteral being used in the pharmaceutical industry, it often refers to injectable products only. So, parenteral preparations are sterile preparations intended for injection, infusion, or implantation into the body. The requirements are more stringent compared to oral preparations. All parenteral products must be sterile, meaning totally free from bacteria or other microorganisms. Pyrogen-free. Pyrogens are substances that are typically produced by bacteria, and they can cause adverse reactions such as fever. Free from contamination with solid particles, for example any fibers, glass, precipitate, or floaters that can come from the raw materials, equipment, or containers. The most common injectable routes of administration are intravenous or IV, where the drug is injected directly into the vein, intramuscular or IM, subcutaneous or SC, where the drug is injected into the fat tissue between the skin and muscle, and intradermal, where the drug is administered into the dermis just below the top layer of the skin. The intravenous route is suitable for small to large volumes. Small volumes can be given as a one-time dose, whereas large volumes will be given slowly as an IV infusion or IV drip. Aqueous solutions should be used for IV injections. Aqueous means a solution in water. Suspensions or emulsions are risky because the solid particles or oil droplets can block the small blood vessels. The IV route is commonly used in emergency situations for immediate action, or when drugs are not available in any other routes, or when large volume of fluid is required. For the intramuscular route, the drug is injected into a large muscle, usually into the arm, thigh, or gluteal muscles. This route can be used to administer depot or slow-release preparations. When these types of preparations are injected, it forms a depot or a storage in the muscle tissue, and it is slowly released into the blood over a few weeks or a few months. IM injection is painful. IM offers more flexibility in drug formulations because aqueous or oily solutions or suspensions can be used. Some examples of drugs that are given intramuscularly are vaccines and antibiotics. Subcutaneous injections are injected into the fat tissue between the skin and the muscle. It is suitable only to deliver small volumes. It provides slow and continuous absorption of the drug. This is because there are relatively fewer blood vessels in the subcutaneous tissue, so the absorption of the drug into the bloodstream takes place slowly. Some examples of drugs given by this route include insulin and vaccines. The subcutaneous route is relatively easy and patients can learn how to administer their own injections. The intradermal route is not so commonly used, but it can be used for allergy testing. It is also used for a limited number of vaccines such as BCG and rabies vaccines. After an intradermal injection, you can see a wheal or blister-like area, like in the photo, that contains the injected solution. Injections are suitable for drugs that are unstable or poorly absorbed in the gastrointestinal tract. It also avoids the first-pass effect. It can be used in special situations such as unconscious, uncooperative, and vomiting patient, or during emergencies when rapid onset of action is required. Absorption of the drug is also faster and more predictable, especially with IV injection. However, injections are irreversible and generally riskier. It can also cause fear, pain, tissue damage, and/or infections. The requirements are more stringent. The preparation has to be sterile. And injections often require administration by a trained medical professional. Dosage forms that are suitable for injections include solutions, dry powders that are reconstituted by adding water for injection before use, suspensions, and emulsions. However, for the intravenous route, aqueous solutions would be safer. Besides injectables, let's look at some other parenteral routes. The topical route means that the medication is applied on a particular place on or in the body. This route is mostly used for local effects on or within the skin. It can also be applied to mucous membranes such as the eye, vagina, and rectum. Some formulations promote absorption of the drug through the skin into the systemic circulation, and these are known as transdermal products. Examples of topical drugs would be corticosteroids for inflammation, antifungals, acne products, antibiotics, emollients or moisturizers, antiseptics, and local anesthetics. Let's take a look at the different topical dosage forms. Pastes are thick, stiff, semi-solid dosage forms that are intended for topical application. They contain a high percentage of powdered medication dispersed in a greasy or aqueous base. To imagine the texture, think of toothpaste, which contains fine solids dispersed in it. Pastes do not flow easily, therefore they can function as protective coatings over the area to which they are applied. Lotions are pourable liquid preparations intended for external use. For example, calamine lotion. You can see in the picture that lotions are liquid, therefore they can easily be spread on large areas of the skin. Gels are transparent or translucent semi-solids used for topical formulations. Ointments and creams are semi-solid preparations intended for application on the skin or other mucosal surfaces. Ointment bases are usually greasy, hence ointments are better for dry skin conditions and can act as emollients, protective barriers, and vehicles to deliver medication. Creams are emulsions. They can be either water in oil creams, which would have a more oily texture, or oil in water creams, which are more common and have a more fluid consistency. Transdermal drug delivery refers to a formulation which is applied to the skin to deliver a drug to the systemic circulation, meaning the drug must be absorbed through the skin and into the blood. Transdermal formulations are easy to use and can slowly release the drug over a period of time, usually up to a few days. Examples of transdermal formulations are nicotine patches and estrogen patches. Drugs can also be administered into the vagina. The vaginal route is suitable for local acting drugs, for example, antifungals for a yeast infection, or systemic acting drugs such as to deliver hormones. The vaginal route avoids the first pass effect and any degradation of the drug in the stomach or intestine. It can also be used for sustained delivery devices such as vaginal ring, which will slowly release contraceptive hormones. Dosage forms that are available for the vaginal route include pessaries, which are suppositories meant to be inserted into the vagina, vaginal creams and ointments, as well as solutions to cleanse the vagina, also known as douches. Using the ocular route, drugs are administered into the eye to treat various eye conditions or to provide anesthesia during eye surgery. To avoid eye irritation, ophthalmic formulations must be sterile. They must have a pH that is close to that of the tear fluid, which is pH 7.4. They must also be sufficiently viscous so that the medication can remain on the eye for a longer time. Eye drops or eye ointments that contain preservatives must be discarded 4 weeks after opening, as there is a risk of microbial contamination. contamination. When using the medication, patients are also advised to be careful not to touch the eye with the dropper, as that can contaminate the dropper. Some drugs are administered via inhalation, typically drugs for asthma or other lung disorders. This route can also potentially be used to deliver drugs into the systemic circulation. Some examples of devices used would be nebulizers and metered dose inhalers. Intranasal formulations are sprayed or applied in the nose. They are primarily used for local effect, for example, corticosteroids to reduce inflammation and decongestants for blocked nose. This route can also be used for systemic delivery. The mucous membranes in the nasal cavity provides a large surface area for absorption and has a rich blood supply. For example, the flu mist vaccine and calcitonin hormone are delivered as nasal sprays. In this section, we have looked at parenteral routes of administration and some of the dosage forms that can be administered via these routes. I hope that this topic has provided you with a good overview of the different dosage forms and routes that can be used to deliver medicines into the body.